More news coming in at this point in time from the national capital a day after the Union Health Ministry raised an alarm over COVID testing numbers in Delhi. Health Minister Satyendra Jain has said that Delhi is conducting the maximum tests in the country, alleging that other states are not conducting even half the numbers that Delhi is doing. Yesterday, the Health Ministry said that COVID testing in Delhi had plateaued in September, despite the fact that there was a massive surge in the number of cases. Those are the details at this point in time. Remember, the national capital is seeing a massive surge in the number of COVID cases, in the number of deaths as well. And the positivity rate is much higher in the national capital as compared to the rest of the country. And this, of course, is a big cause of concern, as the Health Ministry expressed yesterday as well during the press briefing. There are certain measures that have been implemented as well to ensure that this does come under control. And now, of course, Health Minister Satyendra Jain says that Delhi is conducting the maximum number of tests. This is in response to the fact that the Health Ministry said that Delhi is not conducting enough tests and the number of tests have plateaued. Let me go across to Ayushman, who's joining us on the phone line. Ayushman, with respect to the national capital and dealing with the COVID surge, more or less we've seen the centre in sync with what Delhi government feels in terms of implementation, but there have been certain differences between what the centre has to say and what Delhi government has to say as far as the COVID situation is concerned.
Yes, I mean, in fact, if you see the comment from centre, it has clearly said that rightful mixture of antigen and RT-PCR should be done. And that is something which has been missing actually in the national capital, though the Delhi government claims that they have done large number of testing, but the mixture which is actually required, which means that RT-PCR should also be done in a higher amount, as well as the antigen should also be done in the higher amount. That hasn't actually happened, and that is what is to be looked after, because the MHA has said that the RT-PCR even in the national capital is to be doubled in coming days. And currently, we are being told that the percentage of cases coming through RT-PCR is high as compared to that of antigen. And that is why there is a growing need to increase the number of RT-PCR, which the Delhi government is saying that they will be doing in the coming days.
All right, Ayushman, thank you so much for joining us with all of those details. So, of course,